everybody, I'm Dr. Steve Alukonis, and this video I think you're going to find very enjoyable and hopefully helpful. It's going to be on hip pain, hip dysfunction. Down here in Florida, it's extremely common to have hip pain, especially after 50 years old. So I want to talk to you how I evaluate and work conservatively with hip problems. Now, when people say they have hip pain, I want to point out something. A lot of times they'll point to here and say, my hip is hurting me. This actually isn't considered your hip. What I find when they point to here, this is usually coming from your low back. Either a nerve or a vertebrae out of alignment in your low part of your back that's affecting this area, right in here. Hip pain is usually here, right in the hip joint. Now, what are some of the causes? Yes, I understand a big cause is from hip degeneration. But even with hip degeneration, if you're not ready, where it's not bone on bone, I can help. Okay, I can help prolong, usually the surgery. I can keep your pain down, keep the inflammation down with our conservative treatments. But first, I got to figure out, why is the hip giving you so much trouble? Now, when I look at a person, I almost always do this. I look at their structure. Because structure equals function. Good structure, good function of the body part. Bad structure, bad functioning body part. In this case, we're talking about the hip. So I look at the feet, because if you have one foot or both feet where the arches have fallen and there's over pronating, your knee is going to go inward, your hip is also going to rotate, and every step that you take is going to be abnormal. It's not going to be the normal walk that you have. And over time, that's going to produce pain, because the muscles, the ligaments, and the bones are out of their normal position, and they're torquing, and eventually pain and inflammation. So in that case, I want to make sure I give them good professional orthotics in their sneakers or shoes. Okay. The next, I want to see if the muscles that control the hip are balanced or if they're extra tight. Yes, most of the time I find the hip rotators are extremely tight. They're almost like adhesions in there. So when I find that, I will manually, with my fingers, my thumbs, loosen up those tight hip muscles. I will also use instruments to help me assist. This is called a percussor. This is a high frequency vibration that I put right over the hip muscles and move the hip back and forth, and I'm able to restore the normal movement of that person's hip, because I'm getting the muscles to become balanced. Sometimes it's from your iliotibial band that goes along the side of your leg, even your glute muscles and your back muscles. Once I'm done with that, the majority of people say, oh, I can move my hip again. I don't have the pain in there. The other high frequently used machine in therapy is this one, rapid release. Fantastic. If you have chronic hip pain, that means that there are adhesions, there's fixations in the muscles and in the ligaments and all of that soft tissue, we call it. This is a supersonic high frequency vibration. It's the only one patented to get rid of scarring and get rid of adhesions. It's super loud. I just want to demonstrate. I will put one of these heads right over those tight muscles and move it in certain directions to break up the tight muscles and adhesions in that hip joint. 1 minute of this, and their hip joint starts to move better. Okay? Those are the main things that I do. I will give them exercises at home. I will also adjust the lumbar spine if I find that the vertebrae are out of alignment, causing pressure on the nerves that control your hips. These yellow hoses coming out represent nerves. The ones in the lumbar spine, low back, go down into the hips. That's what they control. So if you have nerve irritation or a pinched nerve, you can easily have hip pain. So those are some of the most common things I look for with hip pain. I want to give you natural supplements to reduce pain and inflammation. Nowadays, you know, when you take non-steroidal anti-inflammatories, things like ibuprofen, Advil, you know, if you take it too many times and too often, it gets stressful on your organs, okay, especially your kidneys and sometimes your liver. All natural products are made to do the same thing. We have this one here is to help restore the ligaments and muscles. Another one here is to reduce inflammation in the joints. Inflammation in the joints, how great is that? With no side effects. And the same thing with this one here. This helps inflammation around the nerves. So we'll prescribe and recommend certain specific nutrients to get the pain and inflammation down. So those are the main things we look for. I want to thank you for watching my video on hip pain. Thank you.